Sure, I can, yeah.
Yeah, be a little careful with this one with the feedback. Put it too close. Just use it first. All right. Chris, Dave, Vital Care, off you go.
All right, thank you. I want to thank, first of all, Aging 2.0, Stephen, for having us. We were introduced with Stephen about a year ago at the Hallmark. We came here with the Geron technology, teaching older adults how to use technology in general. At the Hallmark, there was a course with Pace University, and the teacher had students coming here teaching the residents how to use various forms of technology to age in place. So we were introduced to Stephen, we were introduced to the wonderful staff, Sheila, Whitney, and Jonathan as well. And Chris and myself have a telehealth startup company that I'd like to talk to you about today. So basically, first of all, what is telehealth? The very basic definition is telehealth is delivery of health-related services and information through telecommunication technologies. So what does that mean? Well, older adults, we want them to age in place healthy without having to travel to a doctor's clinical physician's office to take their vitals. So we developed a tool where patients and older adults can do this at home. They can take their blood pressure, their weight, their blood oxygen saturation levels, as well as answer daily questions to keep them engaged with their health and wellness. And on the other side of it, a doctor or a nurse can monitor their information without actually being there physically at their home. So we decided there was a few priority areas that we were going to use to kind of solve. We wanted to increase the quality of care. What does that mean? Well, we wanted to make sure that people can access the same quality of health care by living in their own homes. And also expand the access. Instead of people who live here, they can actually do their own information at home. People in rural climates as well, where they have to travel 30 miles sometimes to see a doctor. We want to make an effective tool to allow people to age in place. And the last thing we wanted to solve as a priority area is reducing overall healthcare costs with early evidence-based interventions. So our tablet on the right is our mechanism where people can take their various health data inputs, such as blood pressure we mentioned, blood oxygen, blood glucose levels, weight, temperature, pain levels, medication reminders, as well as answering daily questions personalized to their health and wellness. All that information is very easily accessed by hitting the start button. It's a voice-dictated guidance program where the older adult or patient can answer their questions and take their metrics. And Chris is going to talk to you a little bit about how the clinician side of it takes place.
Thank you, Dave. So this is the second half of the service that we have, is the clinician dashboard. This is an example of a couple of test patients I would like to show you. So as Dave was mentioning, on one end we have the patient putting in the data, and this is what the nurse will actually see. We designed a quick snapshot for the nurse to see what are the different priority areas that they have to attend to on a bunch of their patients. So you can see it's color-coded based on the parameters that they set for them. And what's great about this, as Dave was saying, we have voice dictation service where it'll speak written notes to the patient and they can reply back. So it's a two-way secure communication between the patient and the provider. And also the nurse can also write clinical notes based into the program. And so that's that. Our most recent work, Dave was alluding to, working with the Hallmark. We have we're very lucky to be a recipient of the Pilot Health Tech New York City grant competition. And there were 250 applicants here, and it was based in New York City. We were the recipient of that program. So again, we also partnered with Pace University to use their undergraduate students as well as their nurses to be able to assist older adults in learning the technology and actually taking their vitals. So this is a 6-month program. We've begun with it. And here's just a quick snapshot of how it looks. We have 4 community sites, about 25 patients each, and we have a student that's actually assisting and helping the older adult use the technology and also remotely monitored. So we're really excited to do this and also see how it can really affect the whole different social, economic diversities in New York City. So that's really what we're working with right now, and we're really excited to continue this program. And that's how we're trying to use telehealth to actually Again, lower overall costs, improved quality, and better access for the older adults. Thank you very much. If you have any questions, we'd love to answer and hear your input on what health technology can do.
Great. Another fantastic presentation, just under the wire in terms of timing. Did we see questions? Celeste?
Are you partnering with any hospitals, or who are you partnering with?
Yeah, it's a great question. We're actually very recently we've been starting to speak with different hospitals, Cornell Medical, and also, so we're based in New York City and also Westchester Community. So we're starting to begin, as we're doing these more research studies. We've had one in March, it was very successful. We leveraged that to get this grant. But now we're starting to, now that we have 100 plus patients as a startup company, we're looking to start to work with hospitals and actually build relationships. That's the current phase we're in.
Yeah.
What about long-term care, healthcare, long-term care facilities? Do you have any?
Yeah, we have.
You could just repeat the question.
Yes, the question was about long-term care. What is our business plan for that? We have a partner of ours, which is a home care agency based in Long Island, and they have patients from MLTCs that they need critical care to take their vitals. So we have designed our program to be a multi-user kiosk mode where any tablet can be accessed anyone's secure profile with a 4-digit PIN and the site ID of the patient. And that information gets securely transmitted through HIPAA-compliant servers, so the nurse can only see the signed patient's profile. Yep. Nice touch.
What is hard or will be hard for others to replicate about this?
Well, see, we kind
Repeat the
of,
question.
yeah, that's a great question. The question was, what is going to be hard to have any other customer replicate our model? Well, there's a lot of other, telehealth has been out there for 10 plus years, and what we try to distinguish versus the bigger companies is we have the kind of bridging the gap between healthcare IT and also delivering that information. We work with both the clinician side of it as well as the patient side of it as well. Sometimes you go to a bigger company, they only have a solution from one side of it, and sometimes the one side of it doesn't understand the other side of it. So we try to be the person who's with them every part of the way and working, designing a solution for their personal health and wellness.
And just a second part of that answer. With Pace University, we're taking also the research and educational angle with it. So when we're not only having a student help take the vitals, but also teach them how to use the technology for sustainable, to actually have kiosks set up in different places as well. So we don't want just the student to help take the vitals, but also teach them on their own way to actually use the technology too, because it's scary for them. And having assistants, building a relationship with an intergenerational student is a model that's starting to work and actually take off really, really hard right now.
What was the hardest thing when you did the pilot? What sort of the biggest challenges you encountered?
I think one of the biggest is teaching them, introducing this to them, because this technology is very new and it's very scary. And we've had a very big learning curve when we first started 2 years ago, and we're learning more and more every day. What are their needs? And so basically, to tell them about this and show them that it actually helps them, that was what our original study was in March. And it went really well, and we started to show them how this works, and they have to see it, and that's probably the hardest part, to introduce this to them because it's so foreign.
Yeah.
And they don't know what technology can do for them, so that's...
Right. Last question there.
Yes.
Do you
sorry.
provide the equipment that's needed, or does the patient have to purchase it themselves?
Yes, that's a great question. We have two different models. We have the self-care model where each patient gets their own kit and their own electronic hardware. They can purchase it or lease it and have a monthly service to access a nurse. Or we have the assistant model. For example, a place like the Hallmark, there's 200 plus residents. We can build a kiosk where that information can be shared with multiple users. They can access it in an independent or assisted living facility. There's another question.
Great, that was the last question. Yeah.
It's not a question, but a suggestion.
Yes.
In your marketing this, when you focus on the consumer receiving it, it would be helpful to use a couple examples of outcomes.
Mhm.
So like, what are the results of this gathering of information, but focus it on the consumer, and then also focus it on the provider.
Right.
So that's part of it's not just what this does and how it works, but also what was the impact and what was the result. So I would just suggest
Thank you
that
for
be
saying
part
it's
of
perfect.
the presentation.
All right, great, thanks a lot, guys.
Thank you guys.